The hip replacement surgery is usually carried out under regional anesthesia. That means we give anesthesia in the back and the legs are numbed for 2 to 3 hours, and the typical hip replacement procedure would last for 1 to 1.5 hours, and by that time we would have done finished the surgery. Patient typically stays in the hospital for 3 to 5 days in the hospital. Very good patient can go home in 48 hours. When they are in the hospital immediately after the surgery, on the same day of surgery, they will be made to walk with the walker, and next day they will get up and go to washroom on their own, and by the time I discharge them from hospital, they will be able to go to washroom, climb steps and do basic necessity walking within the closed environment. How long does it take for one to recover after hip replacement? Now the recovery is a gradual process wherein immediately after surgery we make them walk, and then they start walking within the house in a week's time. By end of 2 weeks, majority of the patients will be able to walk without support comfortably within the house. By end of 1 month, they should be able to go out in the community and walk on a normal surface, which are like, for example, pavements or pathways where they can walk comfortably within a month's time. By end of 6 weeks, you can resume back your day-to-day activity and go to work and do any sort of physical activity, including driving and riding bike and those kind of activities. What are the limitations after a hip replacement? Hip precautions, what we call. Now, once you have a hip replacement, you should be careful when you bend forward, and when you are sitting in the chair, you should not cross your legs or put your leg in some awkward positions, because in those positions the hip can dislocate. So you need to be careful for first 3 months after the surgery for the tissues to form around the hip joint. Once the tissues are formed, it is usually reasonably stable joint and it never comes out. First 3 months are very crucial. You can get up, walk, sit in a chair, but do not squat, do not sit cross-legged, and don't bend down to pick up things from the floor. These are very important things which you need to do first 3 months. So how long does a hip replacement last? Typically the hip replacement normally, which is done with a metal ball, would last for 15 maximum 20 years, whereas hip replacement done with a ceramic ball and highly cross-linked polyethylene can last from 20 to 30 years if you have taken care of the hip properly. Younger the patients, lesser the lifespan; older the patients, more the lifespan. That because of the increased demands in younger patients compared to older patients.